Hello, everyone. Welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. I'm so excited to share today's episode with all of you because I recently had the pleasure of sitting down with Shannon. Shannon is a therapist, author, coach, and the creator behind the YouTube channel Therapist Talks, Thrive Beyond Narcissism. She specializes in helping people navigate and heal from narcissistic, abusive, and toxic relationships. In this episode, Shannon and I dove into a topic that so many people struggle with, but rarely talk about: living with an adult child who exhibits narcissistic characteristics. I think it's fair to say that what we spoke about is for anyone navigating a challenging relationship with someone close to them. It could be a partner, a sibling, a parent, or a friend, but we focused on unique dynamics of relationships with adult children. Together, we shared our experiences and perspectives, which were different, on navigating these challenging dynamics, and we offered insights and strategies for those who might be dealing with similar situations. If you're not already familiar with Shannon's work, her YouTube channel is a very valuable resource filled with practical tools and perspectives. I'll include a link to her channel below so you can explore more of her work after the episode. For now, let's get into this important conversation about adult children who are exhibiting narcissistic characteristics. I hope you enjoy it. Hello, Shannon. Thank you so much for being here. I really appreciate you taking the time to come on the show. I'm really looking forward to talking to you about what seems to be a really important question. What is going on in my relationship with my adult child? Many parents ask, is my child a narcissist? And I would say, rather than focusing on diagnosing them, let's think about what's happening in them and in the relationship that makes it feel impossible to connect. And what's really going on here? So maybe that's a good place for us to start. Shannon, from your perspective, what do you see in these situations? Do we want to start thinking about narcissistic traits, or where do we even begin?
Thanks so much for having me, Anthony. Yeah, I'm saying that this is a huge issue lately. I have a lot of, over 200 videos on my YouTube channel, yes. And the one about children, if your son or daughter is a narcissist. And so that one's, getting 80,000 views in a year. And it's just astounding to me. Yeah. And most of the people that call me for coaching are struggling with that too. So it's a multi-pronged and very complex issue. People don't really understand it very well. And so I think it's a great topic for us to talk about.
Mm-hmm. So where shall we begin? What I'm thinking is maybe a good place to start is to give the audience, the listeners, some sense of what might a parent even see in their child, because this whole concept of narcissism is so broad, and there are different, what people call different types different types of narcissism. So maybe you and I could put our heads together, right, and think, what might they be seeing? How does this present itself?
Yeah, and I like to sort of broaden it even more and say toxic relationships. So in my book, I talk about toxic relationships and how to deal with and heal from. And that takes a lot of different forms. And what we also have to look at is what each of us is bringing to the table. Yes. Because as Bessel van der Kolk says, we create templates inside ourselves as children, and then we connect to others in those same templates. So we can connect with others without honoring our own thoughts, feelings, wants, and needs. And that can be true in our partner relationships, but it can also be true in our parent-child relationships. So if you raise your child not to notice or care about anybody else's thoughts, feelings, wants, and needs, and only to care about themselves, that's when we see those narcissistic traits as an adult. And when parents are at their wits' end because their son or daughter is disrespectful, is unkind, is uncaring, is completely self-absorbed, is self-centered beyond any reason, and then uses things to sort of emotionally and even physically beat the parent up in terms of punishing them if they're not getting their way. So it's like a 5-year-old tantrum in a grown-up body. And that's
Shannon,
the kind of thing.
Can I dwell on that just for a moment?
Yeah.
Because you're saying something that's really important, and I just want to make sure I'm understanding it correctly. So what you're saying is that this relationship, this toxic type of relationship, is very complex. And it's not just as simple as, is my child a narcissist, right? Or do they have these characteristics? I think what you're saying is, in a sense, it's more complicated because two things are going on simultaneously, right? It's not just that the child is struggling with whatever tendencies, but that the parent inadvertently is also either contributing to this or keeping this dynamic alive. Did I get that right?
Absolutely. The enabling is really, really important. And when I work with people, and I'm sure you too, when you work with people on creating boundaries for themselves, on creating new dynamics in that relationship, that son or daughter may not really have full-blown narcissism at all. And so you were right in your introduction talking about how we don't want to focus on diagnosing them because it's very much a dynamic. Now, maybe they are being narcissistic in their other adult relationships, and that's on them to figure out. But in terms of the relationship between the parent and the adult child, all they need to do, it's very, very hard to do, but all they need to do is change the dynamic between them and their child.
Yeah, it's so hard because in working with these parents and the children, and sometimes both of them together, things are said in a way that's just the language of the family. That's what I call it. But they're said in such a hurtful way. And it's so subtle that sometimes neither one of them even realize it. But before you know it, if you don't slow it down and catch the way something is said to somebody, like for instance, you need to get a job, or you need to wake up at a certain hour, or why do you wake up so late? Or can you come over here and stop sitting on the couch and help me with, I don't know, decorating the Christmas tree? Recently, I heard this one. Little things like that. And then all of a sudden they get triggered because people don't realize that they're giving a command to their child, as if they're treating them as if they're a child, right? When this is we're talking about adult children.
True, but is the child acting like a child? In other words, when a person is extremely irresponsible, and I've worked with the adult child who sort of is failure to launch. It's kind of what you're talking about. When they get mad at their parents for treating them like a child, but they're not acting as an adult. I always bring that back to them and reflect back to them. Well, are you taking care of yourself the way an adult would? Are you responsible for your own finances? Are you responsible for your own space in terms of keeping it clean and tidy? Are you acting as an adult? Are you acting as a child? And if you act as a child, then you can expect to be treated like one. And when you stand up for yourself as a full-grown adult, then you can expect them to change the way they treat you. So it's very much that dynamic between the both of them. And it starts early on. I've worked with parents who literally never address the 5-year-old tantrum. And so they're still getting it when the adult child is 30.
That's interesting. So
that's really important.
Yeah. So they're not just acting like a child, like you just described, which is true, right? On the manifest level. But when you say this has been going on for a long time, immediately it makes me start thinking about, okay, what else is going on here then that we need to understand that maybe is just under the hood? In other words, why does it become so important to them to not behave more like an adult? And I don't know if you get into that kind of work with the people that you see, but that's certainly something when I'm working with these adult children that I was going to say we're constantly looking at, but it's hard to constantly look at anything because at one moment they could feel so victimized by their parents. But then when we get into this when I can help them get into a more reflective state, then we can begin to wonder. So you said your mother is doing this for you, but did you notice that you positioned her to do this by not doing that? I think that's kind of what you're getting at, Shannon.
Exactly.
Yeah.
Throughout my own life and fitness journey, I have had the privilege of meeting incredible people who've shared valuable insights on mindset, health, fitness, and spiritual growth. The profound impact of this knowledge on my own life has inspired me to share it with all of you. I'm Erica Sweeney, host and founder of My Fit Tribe podcast. Join me as we explore inspiring conversations with experts, thought leaders, and everyday heroes who offer their stories and practical tips to help you on your own journey. Our mission is to empower you to take charge of your health and live your best life.
Yeah. And, we are working with both sides often, and sometimes as a family, which is really challenging. But I think when each member of a dyad of any sort can start taking ownership of their own thoughts, feelings, wants, and needs, and start expressing themselves fully and start taking care of themselves fully, then the dyad can improve and become less toxic. And I've seen pretty remarkable results when people stop the enabling. I had a family I worked with, and the adult daughter was incredibly explosive. And when the parents stopped enabling that, she stopped doing it. But they couldn't see it. They thought they were triggering her into some sort of episode, but she was literally having tantrums because they wouldn't do what she wanted them to do in that moment. Yeah. And then I think a lot of it is just sort of micro and macro aggression to control, manipulate, get their way. But when the family stopped doing that, and then they could have actual conversations about, how do you feel? How do you feel? What's going on here? What's our relationship like? How do we want to improve that? But until the tantruming stopped, it couldn't happen.
Yeah. That's interesting because sometimes, even with the patients in my practice, it's kind of like the other way around, that the tantrums don't stop until the parents can have a different way to conceptualize the tantrums. So in other words, the question becomes, why are they having this tantrum? Like, what's going on here? And what are they really looking for? I don't know if you do this, but I find this very valuable, is sometimes I like to have a theory, like behind a certain behavior, because when you have a theory in terms of why someone's behaving, it kind of lets you get a little space. And I think that's maybe what you mean by boundaries, although I don't want to define it for you. We could certainly get into that. But in my mind, like, a boundary means that you have a little space. And when you have a little space, it gives you a capacity to breathe and become less reactive, and then to engage your mind and begin to think, what's going on here with, little Johnny, not little, but big Johnny, because he's an adult now. And what's he really trying to communicate? And then to try to help him begin to give words to what he's actually trying to communicate, but he does it in a way of a tantrum rather than verbal expression. And that's something that I try to work with, at least with the people that I see, is let's try to put this into words, represent it symbolically rather than literally, like having a tantrum and demanding somebody do something for you. So I was curious to get your take on that, or just to see what you thought about that kind of approach.
Yeah, I think that's great when we're working with a family like that. I think the talking with the adult child and helping them to express themselves differently so that they're not, and again, reflecting back, sometimes they're saying they're treating me like a child. And well, what would a more mature approach be for you to express yourself and what you want and need in this moment than acting in this childish way? And, you have to know your person, whether you can say it that bluntly or not. But in a way, sort of, a lot of times I feel like our job as a therapist is to kind of reflect back what we're seeing. And when you reflect that back, and they can say, oh, okay. So, and then sort of state their needs or wants or whatever's going on for them.
Yes.
And then making sure that the parents are not enabling, because a lot of times the parents are so freaked out by this behavior that they are really enabling, like, sometimes just needing to call it what it is. I had a different family who called, I've been encouraging them. Their child was so violent when they lost it. And I said, well, when they become a danger to themselves or others, when they're saying, I'm going to kill myself and I'm going to kill you, you need to call 911. And they're like,
that's
no,
very
we would
serious.
never do that. And then they did. And then they said, well, that was a huge mistake, because after the sheriff left, then they blew up again. I'm like, okay, so wait a minute. So they lost it again. And so that was really, really triggering. I said, wait a minute, time out. So you're saying, what was he like when the sheriff was there? Oh, just sweet as pie and everything's good and it's all good. And it's like, so you're not talking about, and then as soon as the sheriff left, they blew up again.
Yes,
yeah.
yes.
And so I said, well, then they're not triggered, they're acting out. And when they saw that differently, and they're like, well, no, they were triggered. We triggered that. I said, if they were triggered, they'd be off the wall while the sheriff was there. They were acting out to control and manipulate you by being in a rage, calming down and being perfectly okay while the sheriff was there, and then flipping out as soon as the sheriff left. That's acting out behavior. That's not triggering.
Oh, let's dwell on this one just for a moment, because if we have listeners who are, the adults, they're the parents, right? When you say like acting out and you use words like acting out or manipulating you, what concerns me about that, and I really want to get your perspective on this as well, is it makes it seem like there's really malignant intent in doing this. And you could say, well, there is, like, look what they're doing. But the concern that I have is when the parent then believes that there's malignant intent, there's this like, oh, well, they are now victimizing me. Look what they're doing to me, right? They're acting out. I find it more helpful when the parent, instead of saying, oh, this is manipulative, if they could say, now my son or daughter is trying to communicate something to me and they don't have the words for it. And how can I help them? And I'm not sure if you do that kind of work, but I always want to try to see if I can help the parents, help the child begin, because what you're describing is like someone who's in a very dysregulated state. Mm-hmm. And the question then becomes, what do you do when someone is so dysregulated? And you have options, right? And I'm sure you probably go over these with the parents, right? And one of them is, you could counterattack, right? You could withdraw, you could create a boundary, or you could try to help them get into a more regulated state of mind. And that's really what I do anyway with patients when they come in and they're dysregulated. The first order of business is always to help them get more regulated so that we could talk about things. So a lot of my work with these parents is if they're interested, first of all, and if they themselves have the capacity to even imagine that they can help their child get into a more regulated state of mind, because in the behavior, it's not just manipulative, which it is. I understand what you're saying, but they're trying to communicate something, but they don't have the words for it, and they need a little bit of help. So I was wondering if you had any thoughts or an opinion on that one.
Well, every case is so different, but I really do think that for parents, it's extremely important that they see the manipulation for what it is, because if they are constantly in this narrative of, I'm triggering my child, I'm the bad guy, I'm the abuser here, when they're not, when they're just simply trying to be in this relationship in a healthy way, and their child is literally acting out and manipulating and really going all out in that aggression, I want to put the responsibility where it lies. So the adult child is able to regulate when the sheriff walks in. And so to say that you have to do something differently in order for your child to regulate is not accurate. You have to not continue to escalate them for sure. Like always, you're teaching the parents to calmly step back emotionally, not engage, not argue, not go battle with that dysregulated adult child. But on the other hand, it's not the parent's job to regulate them. It's the parent's job to say, oh, I see they do have those strengths. They don't blow up at work. They don't blow up at their friends. They don't do this behavior to other people. They do it to us because we allow it, we enable it, we give her more money, or we give him more attention, or we whatever. So it's really important that they realize that their adult child has more skills and strengths than they are allowing to flourish because of their enabling behavior.
It's a very different approach than I take, but I understand what you're saying. It's like, it's almost like the onus falls more on the child in that moment. And rather than, to go back to the beginning of our conversation where we were saying there's an interpersonal dynamic that gets played out in very subtle ways. So the difference is, I guess my focus is more on what's going on interpersonally and how can we repair that? Whereas I think what you're saying is, no, that's not necessarily true. And maybe sometimes it's true. Let's not be so like extreme, right? Maybe sometimes it's true. But in this example that you're giving with the sheriff arriving, in this case, it's not true. So therefore, let's put the responsibility where it belongs, right? And this is on the child's behavior, if I understood it correctly.
Well, actually, it's 100% the adult child and 100% the parents. So I'm giving them both really big tasks to change this dynamic, because the parents having to step back emotionally, that's no small feat. For them to take responsibility of their own reactions and their own ways that they feed this frenzy is huge. For them to stop, go for a walk, not engage, not argue, not keep going on the offensive or even on the defensive, just disengaging when this comes about.
Yes.
That's huge. It's sort of like a grown-up timeout, but you're leaving the situation, the parent's leaving the situation instead of sending the child to their room, which you can't do when they're grown-ups. So the adult child has to take ownership of their own strengths of regulation. They have to take care of their own thoughts, feelings, wants, and needs, expressing those, having boundaries if there's a boundary issue. And the adult parent has to learn to step back and not keep engaging in this power struggle. So it's both for sure. Yeah. But it's different.
Yeah,
it's not just interpersonal.
Yeah, I'm trying to picture it because it's starting to make a little more sense in my mind when you said like disengage, right? Because disengaging, the way I'm imagining it at least, it could be literally disengaging, I guess, like walking away. But disengaging could also still that you're there, but you're not emotionally involved where you're triggered also. And if you could still be there, but when the child is, I guess, accusing or attacking you or demanding something like an answer, and you've already given an answer, let's say, you don't need to engage any further. It could just be something like, I already responded to that.
Right.
And well, no, you didn't. You didn't tell me why you can't make me breakfast or whatever. I'm just making this up, right?
Right.
And then the disengagement there is not to get pulled in or get tangled up in something with the other person.
Yeah, and that's a skill that we all need to learn anyway, but especially with an adult child that's in this kind of narcissistic traits modality, it's a super important skill. I call it watching the circus go by. So, if they're amping up and you go, oh yeah, that's how they start. Oh yeah, this is going to go there. Oh yeah, there it goes. And you can, but emotionally step back and remember it's not about you. This is their dance. And you have to keep yourself intact, emotionally speaking.
Yes.
And not engage in that, not go head to head and think that you're going to win because both people lose. It's a lose-lose endeavor when anything goes past that place.
Let's play this out just a little bit more because I heard you use that analogy before, and I like it because watching the circus go by implies, in my mind at least, even like there's a little space, right? Because you're watching something, so you're not in it, but it's a circus. Like there's almost like there's room for playfulness now, which again, in my mind, when there's room for playfulness, now you could function at a symbolic level rather than a literal mode. I talk about this quite a bit in some of my earlier episodes, that sometimes these children or the parents also get into a literal mode where people are making demands or accusations or literally need you to take care of something for them, rather than what's called a more representational mode where there's a little space, like you're describing, to think about things together in a collaborative way. But let's go back. So if you're watching the circus go by, I guess I'm playing this out a little further. What happens next? So you have some space, right? There's maybe a little playfulness to it because it's the circus, and hey, circus, they're fun, right? What typically would come next? Like, are you then in a better position to re-engage, or do you not re-engage? Like, what happens from there?
So I like to teach people to sort of notice their intensity level on a 1 to 10 scale. 10 being like raging or completely melting down, 1 being perfectly calm. We don't want to live in the 5 to 10 zone. We don't want to camp out there. We don't want to interact there, because everything from 5 to 10 is destruction. I'm saying bad things to you. You're saying bad things to me. We're all just like way overregulated and non-regulated. So we need to monitor our own selves and also notice the other person. When somebody else is in that 5 to 10 range, why would you engage? It's just going to lead to destruction. So at that 5 level, there needs to be some sort of boundary in my mind. Like, okay, well, let's calm down, maybe take a breath, maybe take 5 minutes, and then we'll come back at this conversation later. Or I'm not going to keep engaging in this conversation if you're starting to escalate, or you're starting to cuss at me or be insulting. If we can keep it in that 1 to 5 range, cool. If we can't, let's take a break. So that's the boundary for yourself too. It's like, I'm getting pretty amped up. I need to take a break. I'll be back.
I see. Yes.
And so we don't want to engage in that 5 to 10. And then from there, it's really like taking ownership. And if we can stay in that 0 to 5, great. We can have that conversation. If either one escalates, then you step back. And then you can see the circus part is really that we can notice, like, a lot of times those narcissistic traits play out in 1,000 different games, or, in their subconscious. We're not talking maliciously mostly, but, typically they'll go from guilt trip to anger to meltdown, sadness, to guilt trip again, circling back to anger. So trying to get their way in this 5 to 10 zone, there's a whole bunch of different games, but they're all the same thing. They're trying to get their way and they're dysregulated. So when we can step back emotionally and look at that and see it all as kind of the same thing, then we don't get involved and engaged in it. Whereas some people, like, if guilt always works on you, then they're going to keep pushing that guilt button. If that stops working, then they're going to go to anger or victim-y stuff. So you have to step back from all of that and recognize it's all part of the same game, and none of it is productive. And so we're going to wait until we can get back in the 0 to 5 range and have a calm conversation.
I see. Yes. Okay. Yeah, that makes sense. We have to start wrapping things up in a couple minutes, but I'm imagining there's still so much more that we didn't even get to.
Yeah.
Right? Like, we're touching on it a little bit, but I know there are probably even more specific techniques, or, like, I don't know if we call them techniques or tools, that we can offer when setting, setting boundaries, for instance, right? And what I'm trying to describe, I know we could still talk more about this, is what we call, in my field at least, it's called containment, which is if someone is in this dysregulated state, and let's say the parent, a little different than your example, Shannon, where they are, let's say 5 and below, then the question is, if you can, like, let's say you're doing some good work with a parent and they stay in a more regulated state of mind, so they're 5 and below, but the child is like 5 and above, what do you do then? Like, do you still walk away, or do you still give space because it feels like this conversation is not going to be productive? Those are some things I want to continue to talk to you about, but I know you're open to it. We want to do, we said this in advance, that this is going to be way too much to cover just in one episode. So maybe we could kick these things into the second episode, and we could pick up with that, if that sounds good to you, unless there's anything else you want to add before we begin to pull things together.
No, that sounds really good, because there are a lot of specific ways that boundaries work and don't work. And people get very confused about this. And a lot of my videos and the responses, people will say, well, boundaries don't work with this person or that person or whatever. But boundaries always work. They work to keep us safe and sane. But there's an art and a science to boundaries. So I think we could definitely kick off another episode with that.
All right, that sounds great. So everybody, please stay tuned. So in part 2, we're going to do a deeper dive into boundaries. And what I call, again, in my field, this is the act of containment, which has many different sort of steps or components to it. But we're going to break all that down. So stay tuned. We'll be back. And thank you for listening. And Shannon, thank you again for taking the time to be with us today. And we're really looking forward to the next discussion. So thanks again.
Thank you, Anthony.
Okay. All right. Bye for now. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.